one.
Hello, and welcome to IHI Africa Forum. This session is on co-designing sustainable partnerships with patients and community people with lived experience facing inequities, or PLE for short. This session will be facilitated by myself, Shemeka Ebony, co-founder of I Am Brilliant, PLE leader and 100 Million Healthier Lives community champion steward, as well as Yolanda Rory, founder of Total Grace Consulting LLC, PLE leader, and 100 Million Lives community champion steward as well. Welcome to our session. Be a mirror alongside others when they cannot see the brilliance within themselves. This is the center of a lot of the work that I do and the story I bring into this space, because I believe that we all have a light within inside of us that has the opportunity to be brilliant and illuminate. And when we can connect those passions in community, we can create the sustainable outcomes that we want to see in our partnerships with PLE.
For in all of us, there is a destiny tied to someone else. When we focus on bettering ourselves, we become better members of a community. And when we co design with community members and people with lived experience, our destiny is tied to someone else, and all of us together build better communities.
Presenters of this session have nothing to disclose. Thank you so much, Yolanda. Learning objectives. Let's talk about what we're going to be focusing on in our quick session today. We hope that through this content, you'll be able to identify ways to build relationships with patients and community members. We also hope that you'll learn to co-designing improvement strategies with patients and community, that they are necessary to sustainability. And of course, we want to make sure that you have the opportunity to develop implementation strategies sensitive to your target community and your improvement goals. Next slide, please.
Thank you, Shemeka. And here is a reflection from Sarah Callender. During this time, this is her transparent moment as a supervisor working with community champions. Don't be intimidated about this process. It can be challenging, but so is anything that's really worthwhile. Don't worry about making it perfect. Everyone will have unique needs. Just practice asking the community champions how you're doing along the way and be willing to make mistakes. So take a moment to reflect on that. And at this time, we ask that you get out a pen and paper so that you can jot down your grand ideas and jot down your reflections and things that you would like to put into action as a result of this listening session. And now we would like to share with you a shared definition video of people with lived experience.
People with lived experience have knowledge on a system, process, or issue from the perspective of being impacted. People with lived experience are needed to improve results within organizations. People with lived experience have a personal understanding of the inequities and solutions to bridge inequities in a system. People with lived experience of inequities play an integral role in helping organizations relate to communities. The People with Lived Experience team are engaging global and local partners for best practices.
Thank you so much for sharing that, Yolanda. I think it's important here to now take a quick dive into understanding what spectrums of engagement are existing. As community champion stewards with the 100 Million Healthier Lives Scale Community Initiative, we really work from a lens of helping people, organizations, and institutions transition from doing things to the community to the spectrum end that you see here with the community. Examples of doing things to the community historically have been what has been happening in this existing space, where the community is informed, There may be needs assessments or inquiries addressing specific things around health assessments that organizations or even funders are looking to gain information from the community for. Then there's an opportunity to transition, and you may see yourself anywhere on this spectrum, collectively or holistically. And we just want to encourage you to let you know that there is no shame if you're finding yourself historically focusing on doing things to the community, because we're hoping that this will open up new opportunities to move along the spectrum of engagement towards meaningful engagement with co-design. For examples of for community, these may be times when you as an organization or a health initiative in a community may center around looking for ways to have community members as advisors. So they may be brought into a focus group or advisory council. It's really some experiential or event-based consultation that happens where community or people with lived experiences invited to give feedback and input. What we would like to get on the spectrum of engagement is really looking at the brilliance of co-designing with people with lived experience. When we have those that are most impacted, their voices, their insight, their lived experience expertise, we create an environment where community members feel comfortable and safe co-leading with organizations and institutions around improvement work, co-designing outcomes together, co-designing measuring outcomes and goals to make. That creates sustainability hands down through all the experiences of working with communities across scale. The more organizations open up opportunities to grow their capacity to transition along this spectrum, have more sustainable outcomes of building relationships with people with lived experience facing inequities. Now, what we want to lift up here is while we were working with community champions or people with lived experience expertise within the scale communities, through the listening sessions, we found these key points that we want to make sure that we can understand and identify when we look at identifying ways to build relationships with patients and community members. People with lived experience are needed to improve the quality of care within your organization. Having a personal understanding of the inequities and solutions to bridge inequities in a system is going to be from key insights of lived experience going through that system, carrying or holding or experiencing that inequity that you may be seeking to create improvement, design, or better outcomes around. People with lived experience play an integral role in helping health systems be able to relate to communities. Patient-centered care has to have that element of actually listening to people, listening to your patients, and them sharing about their experiences. So having them involved is integral in the sustainability of what you're looking to do for systems level equity and change. And it is most effective to build sustainable relationships with people with lived experience to create a community of solutions, theory to practice. Community of solutions could not be sustainable across the scale communities without the community champions and the people with lived experience being a part at the table of co-designing what change could look like and what sustainability and equity looks like for them within their community. Next slide, please.
Thank you, Shemeka. And let's talk a little bit about the PLE conceptual framework and putting theory to practice. As you are all familiar with or will become familiar with, the touchstones for collaboration, habits of the heart, leading with an equity lens, co-designing, co-leadership, community of solution skills, including lived experience, and space for reflective leadership. So putting all of that into practice, as PLE leaders, we have one unified email address, one voice. We share a group text for communication, co-designing of agendas and meetings. We do well-being check-ins, and there's also equitable distribution of resources and equitable distribution of leadership. All of these make equitable and inclusive, impactful theory to practice. And this is where you would like for your organization to be at all times when engaging people with lived experience, that all of these points are recognized and implemented. So now, head, heart, or feet, we invite you to take a moment. What's still circling in your head? What provoked your curiosity? Your heart, what touched you? What made you want to dig a little deeper? and your feet. What will you put into action or move forward with as a result of what you've heard thus far? Avoiding engagement landmines. When engaging people with lived experience or community members with lived experience, you want to hear your community, seek to understand them, ask and receive their input. Remove the power dynamic. Previously, we mentioned distributive leadership. Give them a seat at the table as well as a position. Have a rotating chair. Remove the power dynamic and distribute the leadership across the board. Communities feel unheard and devalued when they are no longer the center of engagement. Efforts to rebuild communities remain incomplete and lack impact when the community voice becomes mute in the engagement process.
So, we want to take a moment to help you move from understanding to action. I know in our time together today, we've shared a lot of content that may be familiar to you or may be absolutely new to you, and no worries. We want to meet you where you are, and that's to help you see actionable items you can do based on what you've heard so far today, wherever you are on your journey, whether you're re engaging community, whether you're re engaging patients, whether you're looking to start a new initiative and want to hear from people facing inequities in your community. We want to help you do that. So it doesn't matter whether you're a senior leader or a member of the team, you still realistically only have 15%. The other 85% of your power really is in the broader context, is shaped by system barriers, general structures, budgets, events, things that are really out of your control. And that's usually the first thing that we kind of lean on as a response when we're asked to do something that's out of our norm, like adjusting, removing jargon, getting our readiness levels as an organization and institution ready to receive and engage and build relationship with people facing inequities. Part of this is looking at what's in your hand with an abundance mindset, and what can you do if you applied 100% of the power that you have in your 15%. What change can you do? Whether you are a healthcare organization that has an intentional community outreach coordinator, then what can you, as that person holding that power, whether you're a senior leader or a member or even a volunteer, what can you do to create change? We're challenging you today to think about what you can do in the next 30 days with your 15% of power to influence sustainable and equitable relationships and partnerships with people with lived experience facing inequities. Where can you use your power, the power that you have in your hands, if you put in 100% behind the 15%, to really move your understanding of people with lived experience facing inequities and begin your journey connecting meaningfully with building relationships to work on programs and projects and initiatives around improvement science.
Thank you, Shemeka. And we would like to say thank you to everyone for taking the time to listen to our session. For further guidance and support, we invite you to reach out to us at pwleleadership@gmail.com or visit our website, pleinstitute.org. You can also reach out to Shemeka and I at shemeka@iambrilliant.org or admin@totalgraceconsulting.org. Again, we thank you for your time and listening.